What exercise would you recommend for cervical spondylosis?
So simple things like what I told you, even this exercise in a regular spondylosis, which an elderly person can always do. That's one. Then a lot of times people do rotation exercise, which is a great exercise, but they will rotate and tighten. What I tell them is just take your hand, turn and gently push back. So you turn and you gently push, feel. So when you feel you can't turn further up, so if you're going to turn a little more and then stretch that wee bit at the end to feel the muscle stretch on the opposite side is a great exercise. There, because you need to get your mobility back. That's important, right? So the rotations and the side bend. So when I'm going to turn, now this is a very important exercise. If it's done correctly, you will get no pain. But if you do it incorrectly, you will be surprised that you're going to produce a pain. So most of the people will hold their head and stretch as if the neck here is going to touch the shoulder. No. What I tell people, you turn, you stop. You don't have to go to the end. Hold. All you need to do now is take the shoulder slightly back, okay, and push the shoulder down. Okay, imagine your elbow or your hand is reaching the floor. The reason being, the neck you can pull much more, you will not realize how much you're pulling and you're causing more strain. But the shoulder can go only max 1 or 2 inches down. Okay, and that's a safer stretch than to pull your head forward. So you turn, you feel that's all I can go, I hold. And I take my shoulder slightly back and try and touch the floor, which you're not going to. But you will feel a nice stretch on all the sides of your muscles, both sides of the muscles. So that's a great flexibility stretch, which you can do. Where the muscle is concerned, simple exercises like if you're on the table, so if I'm leaning on the table like so, all I need to do is push my neck back. So yeah, so just push my neck back and I hold. So I am leaning on something or I'm leaning on the wall. So I'm holding my hand on the wall. Okay, so that's the wall in front. All I'm doing, what we did earlier, is push back. And you hold. So when you're doing a muscle work, you hold for a few counts and you do it more often. When you're doing stretching, you do 3 to 4 stretches, but you hold for 10-15 counts so that the muscle has its time to open up. So your stretch flexibility into all different directions and your muscle work mainly backward. So a lot of, in olden days, we used to do a simple isometric exercise where you put your hand back and you just do that. That's great. You can even put it a little bit on the side and very gently. Now, a lot of people do. So they tighten their muscle a lot. Now, a very important thing which I tell them, they tighten only 30% of your force. They are small muscles. You don't need too much strength. And they are muscles, any postural muscles are muscles which don't need strength. You don't need strength to sit upright, right? You need strength to lift something. So they are small muscles. You need to do only 30%. So in this direction, again, a lot of people will be here in this and then they will do. Now, this will give you more pain because I'm not in my optimal position. This is the wrong position. This is an optimal position. And then when I exercise, then I work the right muscle. So even if you do the right exercise in the wrong form, you're not going to like it.